Excited today to welcome on the series today Joyce Oh, who is the CIO at Moffitt Cancer Center. One of the better parts of me joining Moffitt and working there is to get to work with colleagues like Joyce, who are extremely talented, very passionate, very driven by the mission of the organization, and are able to keep 1,000 balls juggling at the same time in a very impressive way. I have almost always only done innovation work, but people like Joyce do 25,000 things and they do it gracefully and really well. So here we are today talking a little bit about what drives innovation and prioritization for organizations like Moffitt Cancer Center. And in a minute, I'll have Joyce tell us a little bit more about the organization, and then also get a little bit into her advice on how CIOs can best balance some of these priorities and keep organizations moving forward. So with that, join me in welcoming Joyce. Joyce, welcome to the podcast. Thank you so much for being with us today.
Oh, likewise. And it's maybe only 22,000 things, not 25,000. So
Perfect. So Joyce, tell us a little bit about Moffitt. I know a lot of people, when they hear the word Moffitt, they don't quite right away latch on to the fact that it's this huge oncology center in Florida. But tell us more about the organization and how you came about it, upon it.
yeah, absolutely. So Moffitt is the only NCI designated cancer center in Florida. I think we're the third largest academic cancer focused medical center in the country. Don't quote me on that, but it's pretty, it's very prevalent in what we do. Our mission is actually to contribute toward the prevention and cure of cancer. So you'll even notice that while we are a cancer center, we treat patients, the treatment is not in our mission. It's really about how do we kind of tackle it at the source in terms of prevent it from actually occurring, as well as find the cure. And I think that's even evident in how Moffitt Cancer Center was formed. We're a relatively young organization, I think 1986, where there was a government representative, H. Lee Moffitt, who had, I think, 3 friends who all had cancer, and they had to go far to get the treatment that they needed. And so seeing that and seeing the great need, he really petitioned hard to get this cancer center started. And so I think just even, with those beginnings, that mission has carried through. And almost everybody that I encounter at this organization, has that mission at heart. And, I myself, both my mother and my grandmother passed from cancer. And so just knowing that I could help perhaps contribute to changing, the future of what's, happening in this, this disease is so prevalent, I think really drew me to come here. So being a CIO here now for over a year, been having a great time. It is a wonderful organization.
Thank you for sharing that, Joyce, and sorry to hear about your mother and grandmother, but it sounds like that's what drives the mission orientation that we see in you and we really love about you. So what drives sort of the agenda at Moffitt for all of the IT needs? Where do you feel all the pressure from, and what's driving you guys?
Mm-hmm. So Moffitt has a 10-year plan called Impact and Innovate. It devised in 2018, so it's goes out to Impact 2028. And there's 3 main strategies, I guess, associated with that plan. One is Moffitt Care, which is, clearly caring for patients. The second is discovery, basically through our research. And the third one is like brand and enablement, basically, expanding the Moffitt name so that we could have more outreach, right? And see more patients and ultimately impact more lives. So all that to say is there's needs coming into IT from all over the organization, because that's pretty much what we do. I would say the driving force behind the innovation is the fact that our goals are very ambitious. So just for an example, we're projecting to double our employee size over the next 5 years, right? So what took us, 35 years, to become, like, now we're going to double it in the next 5 years. We just opened our second new hospital, our second ever hospital, I guess, this past summer. We have other ambulatory centers in the works. And so, when you think about Moffitt and the way I've described it, it almost started out like, a single, I think I heard someone call it once, like a clinic on a hill almost. And now the vision is to become a world-class cancer center, ultimately a system. And to be able to become that in a relatively short amount of time, you almost have to innovate because you can't keep doing things the way you've always been, right? It's very different to operate as a single hospital system versus a multi-hospital, right? You're going to have to standardize, you're going to have to automate, right? You're going to have to take the human element out of a lot of things because you won't have the people everywhere, right? So how now are you thinking about data and interoperability and being able to do things remotely and just becoming more efficient overall? And so I think we have no choice but to innovate. So I think for Moffitt, it's not necessarily innovation for innovation's sake, which I think is very exciting, but it's almost like we need to do things with a different approach and a different lens to be able to really achieve these goals that have been set.
And and is that matched by the kind of is Moffitt putting their money where their mouth is? Like, are they telling you to innovate and then not giving you resources, or do you feel like Moffitt is matching that?
So, well, we're being recorded, so no, but no, I will say that Moffitt understands the need for investment to be able to grow. That being said, there's always more work than there are people to do the work, right? And I think this is not new to healthcare. This is not new to Moffitt. I think in this day and age, technology is required for everything we do, right? And I think COVID kind of accelerated a lot of that technology journey. The whole having to get to electronic medical records, that accelerated a lot of it. And I think for me, one of the key strategies to be able to combat this is really closing that funnel, right? So of work requests versus taking the bottom up approach in terms of, well, how do I become more efficient, right? And, manage our work better. I mean, that's very important. But I think if you start at the top and you can really limit the requests coming in, I think that does a lot. It's a lot more effective and less disruptive to the organization. So, when I first arrived, we were about to embark on our annual project planning. And we went around and we asked all the organization, give us your project requests. And this list was probably over 600, knowing that we can do only about 60 projects a year. So you imagine it's quite daunting. So we really went to work in working with our stakeholders and saying which of these projects really align with that 10-year strategic plan. And we canvassed the entire organization, ultimately taking it up to CEO cabinet, right? Our CEO, Dr. Hu, and his team. And they were all on board. And ultimately, we got that list down to, I think, about 50, which were the most critical projects for the organization. And because we had leadership buy-in, the messaging was very consistent in saying, we recognize there are a lot of projects and some of them are very good, but these are the ones that we need to do now. And, we will address the others as either capacity frees up or, perhaps as we do planning for next year. Now, of course, notwithstanding, there's projects we have to do in terms of if it's a patient safety issue, compliance, mandatory upgrades, like we call those non-negotiables. We had to kind of put those in a separate bucket. So now we're talking about the optional value add strategic projects. What we also did was we created a single intake, governance, prioritization process for everything requested. So before we had so many different channels coming through and people were, knocking on somebody, tapping someone on the shoulder who they know, saying, can you, slide this project in for me? And so we created this process and it was just a big communication change management effort because there's no point in trying to limit a funnel when you have like 12 funnels going on, right? What we also did was we separated what we're calling ideas versus projects. And so what was happening was everything was originally coming in as a project. and it would take us, 6 weeks to vet everything. And you know that takes time too. That takes IT resources, that takes, cybersecurity to assess if it's a new technology. We would ask the organization to fill out these very complicated requirements documents. And so we said, you know what? There's some things that people are just more interested in, kind of just conceptually, will this work? And does it make sense to pursue further, right? So it's more of a lightweight process. And so we found that a lot of things actually fit into this idea bucket, where we would provide a faster turnaround in terms of, feasibility and cost. And sometimes, the stakeholders say, you know what, well, then that's not worth it. Or sometimes we say, you know what, let's pursue this further because we think there is value to it. And then it could switch over to the project process, which would be a lot more rigorous, and more traditional. Um, I think the other thing that we did that helps a lot is really make it clear that IT is not the one making decisions on these projects. I think, before there was always a perception that IT was the kind of the one saying thumbs up, thumbs down. And what we did was really empower our stakeholders. And as part of the governance, we created, or we formalized, I guess, the idea of these domain councils. So a project would come in and we would do initial IT triage. And then we had domain council. So when I said domain council, say you have a clinical domain council, a research domain council, an innovation domain council. And so projects then would appropriately go into those buckets, where now the domain council are the people that know that line of business best, would really say, okay, does this make sense based on what we know? And then if it moved forward, then we had a governance, again, where IT was facilitating it, but all the decision makers were actually representatives, VPs from the entire organization. So now we've got all these projects that, by the domain council said, you know what, we want to push this forward. But now you have people looking at everything all together because, again, it's shared resources.
Mhm.
And then, by doing this, I think it empowered the stakeholders, and it also allowed them to, it's almost like, you have to make your bed and sleep in it. So they have to decide, really, do I want to do A or B? I can't do both, right? So now the decision's in their hands. And it's interesting because at the beginning, nobody wanted to say anything, right? Because nobody wants to kind of, perhaps speak up against their peers' initiative or so forth, or they were afraid like they didn't know enough. But as time went on, now we're really seeing this kind of productive conversation, and people are thinking organizationally, and kind of the emotion has gone out of it, and it's not your project or my project. We actually have almost a little mantra saying, we don't even want to call these IT projects anymore. We're just going to call them Moffitt projects because they really are. And it just so happens that this project is enabled by technology. And so I think by employing all of these, techniques and processes and philosophies, I think we've really, changed the way we look at initiatives. And I think that's really helped, one, cut down the initial huge, bunch of projects that we had, but then also make a more manageable process going forward. So,
That's
so
great.
I'll,
Yeah.
I'll, I'll stop there because I talked a lot.
You've answered most of my questions because I was going to ask
Okay,
like
are we done
why,
then?
and there you've given a lot of really good advice. So having said, I mean, it sounds like these processes have been very successful in at least getting you a prioritized list of projects and helping you keep your head above water.
Mhm.
What would you characterize as your three largest challenges still that you deal with day to day?
I think from an IT execution standpoint, I think still is the other side of that, which is now how do we best manage the IT resources?
Hmm.
And so there's clearly still room for optimization. And I think this is where, like, before I joined healthcare, I worked in a variety of other industries, for profit, utilities, restaurant, consumer goods. And so I think there's a lot of, we're very traditional often. And from what I've seen in healthcare, we follow a lot of waterfall methodology, and, projects are these long, 6 to 12 month engagements. And so we've started deploying some more techniques that are being used by, maybe other organizations. For example, we stood up a few project teams late last year to try to see how that model will work. We're taking a more formalized approach to agile. And so where appropriate, we're starting to use that in more of our projects. Another thing we're looking at is, how can we explore more of a DevOps model? So right now, all our teams do everything, right? Projects as well as operations. But does it make more sense to split that up? And then in that case, the operations, could we look to, outsource that, right? So then that way, our staff can do the more value added work, hopefully something that's more engaging to them, and also the work that needs that in-house expertise.
Mm.
And then at a lower rate, perhaps, can we outsource or offshore kind of the day-to-day mundane tickets, patching, upgrades? With the added benefit of that kind of work, you can often, you can tie SLAs to it, right? So now we can hold our partners accountable if we go that route. So, all that to say is, limiting the funnel was great, but we still need to be best to best manage the resources that we have. And so I think now that we've got some of those processes in place, it's now continuing to kind of make that a habit. And it's even things like making sure everybody puts in their time and puts it in consistently. That's not exciting, but
Yeah.
you really need to do that to be able to know what you're spending your time on, and then to be able to then petition for new resources as you need them. If you don't have those metrics, then you're not able to. And at the beginning, we didn't have any of those metrics. Now we're starting to get them, and it's been actually quite eye-opening, because we also have the benefit now of seeing which teams are really overutilized. And so, then that might be where we need to, now double down on our hiring efforts,
Mhm.
and so forth. So I think, really just then in the day-to-day operations of IT, that was another big opportunity. But then I think finally, I think one of your original questions is, how do you balance KTLO and innovation? I think we have to put them, for us personally, we had to put them all in the same bucket, because we had the same teams. But because innovation and growth is part of our strategic plan, I think there is a place for it. And so, we just throw those projects in along with everything else. And, if it makes sense to do an innovation project, we do it, because it's going to enable either better patient care, or, allow us to do, something that we wouldn't have been able to do before.
Great. Yeah, that makes a lot of sense. What are your favorite innovation or cutting edge projects that you and your team are working on?
I think a big one that the team is very proud of is, the new hospital that we opened in July. And, one of I guess the goals for the hospital, in more of a, kind of a, I'll say a North Star, right, was to really think about, how can we make this a paperless hospital? Of course, that's not actually going to happen, but that was the mentality, right? So removing, the printing and the forms and the faxing. And so some of the technology that was put in there, I had never seen before. We've got, like, digital door signs, right, telling you, who's in the room and what are the guidelines in terms of safety precautions. There's real-time location tracking. And so, when a nurse or a doctor walks into the room, their badge is scanned. And then on this giant screen in the room, it shows you, this is, Dr. Betty, right? And this is who she is. And it kind of gives that ease to the patient. Just there's just lots of, the beds, they'll do like the measuring of the patient, right, in terms of weight, and there'll be alarms if the patient falls, and alerts if the patient needs to be turned. And so I think the opportunity to work on a lot of this kind of new innovative technology, was really exciting for the teams, and they learned a lot. I think they surprised the organization. The team surprised themselves probably, but just to see that come to life was really super exciting. And actually, one of the first patients in that new hospital, I had found out, was a former IT employee of Moffitt,
Oh,
right?
wow.
Who is now battling cancer. And to me, that's why we do what we do, right? So it's not about the innovation, which is great and is exciting, but the fact that now we can treat more patients and, even our own, peers that we've worked with, I think that's really what makes it super exciting.
That's great. That's wonderful. I'm gonna wrap this up because I think you've answered all my questions, and I think you've answered the next one as well. But I'm gonna ask you to reframe the answer a little bit, and I'm gonna ask you to reframe it as what's that single piece of advice you would give maybe a new CIO starting out? And how they can be successful in their role.
More and more so, it's actually not about the technology. Um, it's about understanding the needs of the organization, the needs of the stakeholders, and then figuring out how technology can best enable that. Too often, both IT and I think the stakeholders can be guilty of bringing a technology and saying, okay, what's what's the problem we're trying to solve with this? And it really has to be the other way around. You know, the analogy that I like to use a lot is, say you've been making cake for years using like that $3 cake mix you get at the grocery store. And then one day you buy like a $500, KitchenAid mixer. But then you take that same box of $3 cake mix and you use that mixer. What are you going to get? You're going to get the same cake, right?
Mhm.
And that's the analogy. Sometimes we just get this very expensive technology and then we still just incorporate the same processes and we don't think about how to really maximize this. And so I think as a new CIO, sometimes it's like, well, it's about the technology and I have to make my mark with the technology, but really that's not going to be what's going to move the needle. It's really helping um, propel the mission forward by using technology, but you really first have to understand what that mission is and what that strategy is. And I think that's where I think CIOs being able to understand the business, understand the major short-term and long-term goals, and really develop those relationships with the stakeholders is so important. And then the other side of it then is making sure you communicate that down to your teams because they need to understand the mission as well. Because that will help motivate them and that will also help them prioritize appropriately, right? Because I can't be everywhere at once. My team can't be everywhere at once. And so even if I'm saying, the message like we've got to align to the organizational goals, if my team down there is still doing whatever, like that's not helping me, right? And so, just as much as outward and upward communication is important, a CIO has to be able to clearly articulate and communicate to their teams so that everybody's kind of rowing in the same direction and working, towards the same objectives. So, it's like it's nothing that hasn't been said before. And then the other thing I would say in terms of healthcare specifically, it's really about the human connection. I think healthcare is very interesting in that no matter what, you will never take the person out of the equation, right? You always have to have that interaction. And so you can never forget that. And just remembering that somebody who's coming to especially a place like Moffitt, they're probably uncertain, they're scared. There's a lot of unknowns, and to really just have that compassion in everything we do and in the people we interact with, I think is really important because at the end of the day, we all are working for the same organization, and we should all represent that.
Very well said, Joyce. Thank you so much for your perspective. This is super eye-opening, actually. I'm sure for a lot of the audience, but definitely for me, and how you've been able to sort of manage this and run such a large organization that effectively. So thank you for sharing your thoughts and really, again, thank you for agreeing to do this podcast with us and joining us.
Well, thank you for having me.